Hello, I'm Nelson Liu, and thanks for joining us for Western Perspective. This week, Indigenous deaths by suicide have been one of the most under-addressed issues impacting WA's Aboriginal population, affecting families across the state. The state government is working to improve the situation with $10 million worth of new funding and a targeted region-to-region plan.
This is a first for Western Australia. It's not a one-size-fits-all approach. It recognises that each region and each community will have their own needs, their own pressures and their own solutions. It means the communities will be heavily involved in how we address the issue in their particular region. We know that they are the experts and it's with them that we should be working. We recognise Aboriginal people and their culture as one of the state's greatest assets. So we are working closely with Aboriginal people to deliver culturally centred and community-specific outcomes to improve the outlook for young people.
However, advocates warn the funding isn't adequate. The National Suicide Prevention and Trauma Recovery Project's Megan Krakouer tells us why in this interview.
We've had this new announcement come out about $10 million of funding to prevent Indigenous suicides. Do you think this is an adequate amount of money?
No, it's not. It's not adequate at all. With the National Suicide Prevention and Trauma Recovery Project, we see between 200 to 250 people per week, some of the most marginalised, some of the most vulnerable in our community. Some of the families don't even access some of the services and so forth. $10 million, they don't say what the forward estimate is. The forward estimate is over 5 years. We have 120,000 Aboriginal people throughout Western Australia. Suicides are going up, incarceration rates are going up, children being removed are going up. This issue, in terms of the $10 million, that is a drop in the ocean, and that's not going to make a substantial difference to our people at all. The people that we're dealing with on a daily basis in terms of the homeless, where people are committing suicide, where there's suicide prevention and so forth. It's all very well to say, yeah, let's pour $10 million over 5 years, but is that going to translate to outcomes on the ground? More planning, more consultation? That's not what we need. We need tangible we need tangible and real life opportunities to ensure that people are being afforded the best care, the best understanding, the best respect in the sense of keeping their child or in fact them alive. So therefore there is a disconnect. There is a disconnect right now. And what we're seeing at this service is that a lot of the people, and I carry thousands of people on my shoulders when I actually speak to the media, when I go out to conferences and so forth, $10 million is nothing. And it's not going to make any difference whatsoever. Who is it going to benefit? Okay, there's going to be people that get some employment out of this in terms of going out and doing some consultation and some engagement. But if you look at it, 120,000 Aboriginal people in Western Australia, $10 million over 5 years, 7 to 8 different regions. How is that going to have a profound impact on the people doing it tough? The real issue is this, it's a lack of housing. In the last 3 years, in terms of Western Australia, public housing, 1,300 less. We have people sitting on the waiting list, 14,000 in fact. In terms of children being removed are at an alarming rate across this nation. And in Western Australia, 6,000, so that means that there's 56% of our children currently in care. So, in terms of getting the answers, it needs to be driven by the community, and this whole thing in terms of Aboriginal people leading conversations, I agree with that in many ways. 100%. Our people need to be empowered to deal with our issues. But the social and emotional well-being, that's been happening for decades now, and complete ownership and control by Aboriginal people. This is a life and death space. This has to be expert-driven. And that's what the issue is here. We need to keep our people alive. This in fact means that is the $10 million, is that going to ensure that there's assertive outreach to our people? Is that going to ensure that there's 24/7 to our people when they're in trouble?
Just to clarify something there, you said this needs to be expert-driven. Are you talking about Indigenous cultural expertise, or are you talking about sort of Western medical psychiatric expertise?
Whoever's got the best expertise around this. It's the same principle as this. You go to a hospital, you're having a heart operation. As an Aboriginal woman, I'm not saying I'm an Aboriginal surgeon that can perform the heart surgery on me to send me home so I can safely be with my family. I'm not saying that. When I go to a hospital and I need a life-saving operation, I want the best person to provide that skills and that expertise to ensure that I'm safe so I can go home to my family. So in terms of this whole thing about black, white and brown, we're all brothers and sisters. 383 people took their lives last year. $10 million and the $32 million that was already committed, that's for all. This $10 million, that's for Indigenous, but still it's a drop in the ocean. It's not going to be worth the piece of paper that it's written on. It's certainly not going to translate into outcomes for our people that we're dealing with on a daily basis.
Roger Cook said that through extensive consultation with communities throughout the state, the need for on the need for regional, Aboriginal, specific intentional suicide prevention. He said that an extensive consultation was very important to the government. Were you part of that consultation? Have you seen evidence of that extensive consultation?
No, we weren't part of that consultation at all. Yet we have the National Suicide Prevention and Trauma Recovery Project. We're on the ground. We're dealing with 200 to 250 people per week. Some of the most critically vulnerable that aren't getting a service. There's also, we need to have a look at the government responsibility. More mass investments in the social support to our people on the ground there. More social investment. Stop taking our kids away. More houses. We know that homelessness is an issue. We know that there's 1,000 street present homeless in the Perth area today. Build more houses. It requires the political will. The political will needs to be there to make the true and the meaningful and the historic changes that is needed to reduce the suicide rates in this country right now. In terms of Western Australia, that $10 million, that's pittance. It won't do anything because it's not going to reach the community that we represent.
And now, the AMA WA's President, Dr. Andrew Miller, provides his weekly COVID-19 update.
Hi, thanks for your time. Just wanting to update a few things on where we're at with COVID today. Firstly, Victoria, running between 300 and 400 cases a day. The curve seems to be relatively flat at the moment. That is, it's not increasing dramatically, but this is still an enormous number of cases every day for the contact tracers to then get on and find all the potential contacts of them, just adding to the load a few thousand contacts that have to be done every day in Victoria at the moment. So that system must be, under an enormous amount of strain in order to keep this under control. The hospitals there, of course, now seeing quite a load, a few hundred cases in hospital, nearly 50 of them in intensive care unit, and unfortunately a number of deaths. This is what it looks like as the pandemic takes control of a city, and we're hoping that the actions that they're taking will be able to continue to flatten and then reduce the number of cases that they're seeing every day, and our hearts go out to them because they must be getting very tired with 1,200 healthcare workers now isolated in quarantine at least, several hundred infected at least, much higher than the normal rate of the population. We're very concerned about the way that workplace safety has been handled there. Either people are getting it from patients or more commonly from co-workers. So we know that the controls around the COVID risk are not adequate. The elimination from the workplace, the engineering controls, air conditioning and all the spaces that are available for people to work in, and the administration, so things like the rostering, having adequate people on so that people aren't getting exhausted at work, and then of course the PPE. Time to stop arguing about what sort of PPE is appropriate. The minimum is not enough. Arguments around how this spreads, it's time for that to be over. We just need to give people the best that's available. We're a rich country, we can afford that. If we can afford to have national sporting codes relocated, if we can afford to run a mining, oil and gas industry in these circumstances, we can give our frontline healthcare workers the best things that are available. Of course, Victoria has made the jump, and New South Wales partly, to using masks now in amongst the community, as is appropriate with community spread. People around the country need to get used to the idea that that could well be a feature near us soon if there's not enough social distancing, and people shouldn't be ashamed or embarrassed at all to be wanting to do that, particularly if they have vulnerable health themselves. It has the added bonus if you wear a mask when you're in situations of reduced social distancing, that you're less likely to catch other sorts of viruses that might be around, such as influenza and rhinovirus and so on. So still very concerning, particularly around the number of people coming into Western Australia, and gratified to see the government tightening up around hotel quarantine tightening up around the arrival of truck drivers and pilots and so on from interstate. We don't point these things out to be critical. We really want to be constructive, and when we hear things from people on the front line, we want to know whether those very obvious sources of COVID within our community are being properly controlled by people who really know what they're doing, so that these small community clusters don't start to grow and get beyond control. One of the things that is very apparent with this disease is it can spread without somebody knowing that they even have the disease, what's called asymptomatic spread. So whilst we want people to come forward if they have symptoms to be tested, then those who don't have symptoms ever may not get tested, and these are the people who could be spreading the virus around if they've had contact, for example, in a hotel or with an interstate truck driver or pilot or flight attendant. So we welcome moves to tighten this up with ADF in hotels and with a testing regime around truck drivers. We need something that works for freight and logistics, because obviously we have to get all our food and all our other supplies into and out of the state. And the community, I'm sure, will cooperate with anything that keeps that happening. Phase 4 is very good. We're all enjoying Phase 4 here in Western Australia with the increased freedoms and the decreased mental health stress. We know there are still some people suffering. We do need to look at whether super spreader potential events with large crowd gatherings are still a good idea in Phase 4, and we certainly need to stay away from any suggestion of going to Phase 5 and opening things up even more broadly at this stage. Great that there's lots of people getting out and enjoying tourism across the state in a safe manner. And also on a positive note, the news out of Oxford around there being a vaccine that's looking pretty promising is great to see. And all of the people who know a lot about vaccines are still pretty optimistic that we'll see something in the next year or less time that will be very useful for this disease. So whilst the first vaccine may not be the one that goes on to be the best vaccine, so much effort, so much energy, so much incredible brilliance going into that I think it makes what the rest of us are doing in terms of the hardship that people are going through all the more worth it, knowing that there's a goal that is within sight. So stay safe, look after one another, and thanks again.
And that's all for this week. We'll be back with an all-new episode of WP next time. But until then, it's back to you, Ivan and Sarah.
Thank you, Nelson. Coming up on Crossfire this Tuesday night at 5:30, former Melville Mayor Russell Aubrey is going head-to-head with Rail, Tram and Bus Union WA Secretary Craig McKinley. They'll be discussing whether Row 8 is still needed and is freight rail the real solution.
We've got another government in power. We're in a COVID-19 world. Now you've got to ask yourself, is the government, is the public going to be accepting of throwing billions and billions of dollars for the trucking industry?
Well, no, but it's it's federal money. This
doesn't matter what money it is.
Oh, well, I think
money.
they are, and it's cost efficient. And if you remember,
the environmental groups are particularly have political traction. There's political capital in the environmental groups. The Greens.
The Green preferences, yeah.
Well, you know, we can say, it's just politics, but politics is everything.
You're saying it's politics. I'm saying rational thinking should be dominating here, not politics.
Well, Ivan, that one's not to be missed.
Hopefully they'll work it out.
I'm sure they will.
And that's our weekly news and current affairs. For news anytime, you can go to the website and social media pages.
For now, see you next weekend and have a nice evening.
Good night.